Hello, my name is Cynthia Baker, and this is the recording of my proposal defense for a study titled Wellbeing of Frontline Healthcare Employees in Long-Term Care Nursing Homes. The COVID-19 pandemic has created high levels of occupational stress within long-term care nursing homes, leading to a negative impact on frontline healthcare employee well-being. Scholars have identified elevated emotional and psychosocial distress in healthcare, especially healthcare workers who have unmediated contact with COVID-19 patients. Prior to the pandemic, studies identified 50% of U.S. physicians experienced burnout. Now, recent studies since the beginning of the pandemic show that burnout, moral injury, and post-traumatic stress disorder are at their highest levels. Frontline healthcare employees working in long-term care nursing homes are at significant risk of exposure to COVID-19 infected patients. Long-term care employees account for 38% of 1.5 million nursing home COVID-19 cases, and healthcare workers describe the situation as terrifying, with safety concerns due to constant adjustment to the new CDC safety requirements have left facilities with widespread shortages of PPE, challenges allocating insufficient resources such as ventilator support, and the existential stress related to personal infection, illness, and death of infected patients, colleagues, and family members. The frontline long-term care employee demographics add risk factors increasing stress levels and illness. Disproportionately female and 40% non-white minorities, low education attainment, and over a third with household income levels less than twice the poverty rate. The demographic group working in long-term care also have increased risk of comorbid health conditions, such as high levels of obesity, smoking history, and hypertension that add more vulnerability to COVID-19 severe illness. The Chapter 2 literature review defined well-being. Predictors and antecedents of well-being, such as job resources, job control, and autonomy, and supportive leadership styles, such as transformational and crisis leadership. Barriers and challenges to well-being may be such as organizational change and toxic workplaces, and studies revealed crisis levels of healthcare employee stress, exhaustion, burnout, and compassion fatigue. The purpose of this study is to examine employee beliefs about the impacts of COVID-19 and identify organizational and leadership practices implemented during COVID-19 pandemic that may have positively impacted the well-being of frontline healthcare employees in long-term care. This study includes 2 research questions. Research question 1 is how has burnout, emotional exhaustion, and fatigue impacted long-term care frontline healthcare employee effectiveness throughout the COVID-19 pandemic? And research question 2, what, if any, specific strategies have organizations and leaders in long-term care implemented that support the well-being of their frontline healthcare employees during the COVID-19 pandemic? This study may be most significant to frontline healthcare employees working in the long-term care nursing home settings. The study may be most influential in recommendations to long-term care industry employers to help with finding and retaining healthcare employees. There were shortages in the workforce pre-pandemic that, due to COVID-19, have reached crisis levels, and turnover is an enormous problem that affects the industry and ultimately impacts residents' quality of care. Annual nursing home employee turnover rate averaged nationally 45% and may cost nursing homes nearly $4.1 billion. This slide is a visual of the conceptual model of this study and an integration of the theoretical framework of social cognitive theory, key concepts from the study's research questions, review of the literature, and the researcher's theory of change. The conceptual framework identifies the connection between organizational support strategies and the effect on long-term care frontline healthcare staff working in nursing homes during COVID-19. Organizational leader supports and resources influence the well-being of healthcare staff Depending on if there are enough positive supports and resources to reduce the staff cumulative stress, their emotional exhaustion and fatigue that may result in burnout, which is the inverse of well-being. More strategic organizational supports and resources increase healthcare employees' self-efficacy, their agency, and healthy behaviors that elevate well-being. The study's participants work on the front lines as direct caregivers at long-term care nursing homes. The majority of the sample lives and works in Missouri. Using Rayosoft sample size calculator, a census over 20,000 at a 5% margin of error resulted in a study sampling unit goal of 377 participants. The study will comprise a convenience non-probability sample, and the researcher plans to obtain 377 participants from 14 long-term care facilities that employ approximately 1,200 frontline healthcare staff. The survey instrument will be administered using Qualtrics' online software tool and include 13 Likert-style questions pertaining to the key concepts from the study's research questions and questions about pre-during pandemic employee effectiveness and well-being. The survey instrument also contains 2 open-ended questions measuring effective organization policies and procedures and leader-supervisor strategies that support employee well-being. Demographic questions will identify gender, race, ethnicity, household income, and educational attainment. Because the researcher is borrowing questions from other validated tools, the instrument will be piloted outside the participant sample to test reliability and validity. For data collection, following IRB approval, the researcher will email an informational letter about the study and the Qualtrics survey link to corporate office leaders who have agreed to email the study information to their 14 long-term care facilities. The researcher will monitor participation weekly and encourage facility administrators to share the information about the study during staff communications, and also post the survey information in employee work and break areas. To ensure participant anonymity and confidentiality, written information is provided about the importance of the study and that participation is voluntary. The researcher will not request names or personally identifying information from participants. For data analysis, frequencies will be calculated. Means and standards deviation will be presented to identify average level of responses. Descriptive statistical analysis will be conducted once all survey results are submitted, and the researcher will code the open-ended questions and analyze results. The timing for the study is that following successful proposal defense in November, an application for the study approval is submitted to IRB. December, while waiting for IRB approval, the researcher will pilot the survey instrument and make any necessary changes. In January 2022, after IRB approval, the researcher will collect data. And then in February and March, the researcher plans to analyze data and provide recommendations. In closing, I want to thank Dissertation Chair Dr. Bryant Adebayo and committee members Dr. Kimberly Hirabayashi and Dr. Mary McNevin for providing significant guidance and support for this important topic of study. Thank you.